Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. I keep thinking about a patient I saw last month. He was a farm worker from Oaxaca who had been having chest pain for 3 weeks, but didn't come in because he couldn't miss a shift. When he finally showed up, he apologized for his English, for not having the right paperwork, for taking my time. He'd learned somewhere along the way that healthcare wasn't really for people like him. And that man wasn't in health conference hall. His face wasn't on marketing materials. Nobody was designing products with him at the table. And I kept asking myself, who is all this actually for? That's the question I brought to my conversation with Dr. Luis Padilla, Chief Health Officer for the National Association of Community Health Centers. His organization represents over 1,500 health centers across the country. And if you're working at a community health center, you're part of this network. 17,000 sites caring for 32 million people, and really most of them living below the poverty level. And there's so many terminology for this population. And sometimes it feels dehumanizing, underserved, disenfranchised, unhoused. Whoever they are, they're just people rebuilding their lives in a country that often treats them as invisible. For 60 years, community health centers have done something that most tech companies are still trying to figure out: trust. Patients return to these clinics not because of some cool interfaces or chatbots. They return because someone looked them in the eye, learned their name, and asked about their family. They spoke their language, linguistically, but also culturally. They understood that a Marshallese elder and a Somali teenager and a Mexican grandmother might all need something different, even if they all come with hypertension, back pain, whatever the complaint is. It wasn't built by technology. It was built person by person, visit by visit, over decades of showing up in communities. In this conversation, Dr. Padilla challenges us to think differently about technology in healthcare. You'll hear him wrestle with the tension many of us feel. How do you expand access without losing the relationship that makes care effective in the first place? For communities that have been experimented on, extracted from, and excluded, I think about this all the time. Trust isn't a nice to have. It is the prerequisite for everything else. This episode is part of the question I've been sitting with throughout the conference and this series that I'm bringing you. Can technology scale privilege? Dr. Padilla has spent 20 years in underserved care thinking about exactly this, and he doesn't come to the table naive. He knows health centers need margins to survive. He knows the business case matters, but he refuses to let financial calculations erase the humanity at the center of this work. Here's Dr. Padilla. Thanks for being here with me.
I'm excited.
My podcast is about culturally responsive care, and so many of my episodes are interviewing people from the community on what does care mean to you. And sometimes I come to these conferences and it feels so distant from what communities and patients are needing.
Yeah.
So I'm always reaching out to see what resonated with you. What do you feel like the intersection of tech and equity looks like from your perspective?
Yeah.
Those are the questions I'm thinking about. I would love to hear your name and where you are.
Sure. Again, Luis Padilla, Chief Health Officer for the National Association of Community Health Centers. And we represent the over 1,500 health centers across the country, 17,000 sites, caring for 52 million individuals and their families across the country, primarily those living 100% or below the poverty level. So those that are underserved, disenfranchised, homeless, et cetera. So when you talk about cultural care, this is what we've been doing now for 60 years, and we'll continue to do so because there's great need out there, unfortunately. Yeah. And to your first point, I feel that same way too. I went back to my hotel room last night. I'm like, okay, what is the connection here that we're trying to make? And I will say that, looking at the vastness of these tech solutions, I'm particularly interested in how we could find solutions that are equitable for health centers, affordable for health centers, and help to address some of the needs they have primarily around expanding the care team. One of the strengths of community health centers is the trust that patients have in them. Overwhelmingly want to come back to health centers because they get that personalized, patient-centric, family-centric, community-centric care. And so how do we create an environment that uses technology that doesn't lose touch with that, but expands the care team to increase access for individuals. And that's what I'm looking for here, because there's a lot of glitz and a lot of glamour, but the substance, I think, of what we're interested in is how do we expand our mission in an equitable fashion that doesn't lose touch with our grounding, which is serving communities that need access to quality care.
Trying to weed through AI-powered intelligence and trying to figure out what's actually being done. Right. Is there any idea, we don't need to name companies, that resonated with you of like, this is a solution for a care team? Because I hear about agentic AI and all these jargon somewhat, but when it comes to it, you're like, this is actually going to be really powerful for the communities that we're serving.
I think you just named one, agentic AI. It's interesting. And that's exactly what I was just thinking about is that may be a possible solution to expand the care team if we find companies that are willing to venture down that difficult path of co-designing, perhaps. Many of these solutions are baked. And can we find partners that say that, it's not fully baked, or we have an appetite to modify our solution to benefit your needs and your community member needs? And I think that would be golden in terms of a partnership. And our ability to get people together to express their needs and solutions that they have in mind, and they just need willing partners to help to say, hey, we're willing to build that with you or modify what we have to meet your community members' needs.
This is why I love talking to people like you. It's not just about the idea or the product. It's about how you designed it, that co-design and collaboration, especially from people who are disenfranchised.
And bringing that voice. I mean, our community members are not at this conference. And so someone has to represent that voice and find partners who are willing to say, we want to listen to that voice. And we're willing to venture down that path. And maybe it's not an easy path, but it's one they're willing to take.
How have you navigated this conversation around ROI? I brought it up with my last guest because that's the other sticking point. I walk around and what is the ROI on patients who are vulnerable and disenfranchised? It gets to this very, at least for me, dirty feeling of how do we make this population profitable? Right? There's ways to have that thoughtfully and gracefully, but still the language around it doesn't feel great. Curious on how you approach it in a way that centers the community. So it feels like, hey, we're solving real problems, getting people to the table and speaking the business language too, so people understand what's happening.
Yeah. And certainly we don't want to come across naive, like, well, the business side doesn't matter. Of course it matters. But for me, the ROI is a bit personal, and that is the ROI is making people healthy. And in my case, in 20 plus years of underserved care, making those that are in these communities healthier and accessible and have access to the quality care that health centers have been providing for 60 plus years. So the return on investment, I kind of flip it and say the return on investment is actually how can we assure that there's going to be an improvement in the quality care, the alignment of a community member's culture with the care that they ought to receive, right? Yeah. And overall, just saying, look, you as a person, as a family member, community member, and having family, you deserve to have good quality healthcare that's respectful of your background and your condition and your status in your community. Yes, there's going to be some margin. Health centers have margins or else they'd close their doors, right? Yep. But they're mindful of the margins that they have that go back into the services that they deliver. And that's why my entire career has been in public service and nonprofit or public sectors. And it will continue to be because that's the ROI and that's what NAC is interested in doing.
What do you think of in the community, and you interact with staff and patients, their trust in AI? Because the other thing that I'm hearing here is outside of the ROI, it's like a product's delivered, they're not co-designed. Sometimes it's like, okay, now let's figure out how we can make this trustworthy as a last adoption strategy without starting from the beginning of what does community think about AI and how do we approach it from that place?
Well, I think the majority of our community members, and I don't want to disparage them, because I'm sure there are individuals there that know a lot about AI, especially the younger generation, but I would venture to say a lot of them don't, and I think they're just the regular Joes and Marys in the world, just like us, that like AI. What's the difference between generative and predictive AI, right? I don't know. No. I think going back and saying, can we get into an environment of co-designing and having a level of transparency here? Yes, there's proprietary data, algorithms, et cetera. But how much look-see behind the curtain can our community members have and those who represent our community members to structure a solution that is mindful of inherent biases that can occur and foreseen circumstances that really not only don't achieve a solution, but make it worse, right? And the reason why I think co-designing is so important is health centers would have to make an investment here at some point. And they need to be very careful about the investment that they're going to make in technology and solutions that are actually going to meet their needs and address their community members' needs in terms of healthcare. And you can't do that unless you create an environment of co-designing somehow.
Yeah, I don't think it's possible. The other theme that stuck with me, I was talking to somebody of this idea about scaling privilege, and that might be the theme of my series. The idea of scaling privilege, meaning so much is accessible and affordable to certain people in this world because of their privilege. And can you scale that with technology? For example, can you raise the floor in the quality of care using technology so members who traditionally didn't have access to specialists, now with technologies like e-consults, can access specialists? So another technology I was thinking of with that theme is AI voice agents and thinking about speech-to-speech conversion for interpreted visits. Because I think about 15-minute blocks for every patient, but if you're interpreted, it's cut in half sometimes, right? And you don't get the same time. But if you have the speech-to-speech, I don't know if you've seen those videos with United Nations where they're talking and there's live translation, so there's no lag. And if technology can do that, could you raise the floor on the quality of care for all those interpreter visits?
Right.
Are you seeing anything else in technology in this conference that you feel like has the capacity or possibility to do that?
I think those, and I've seen those technologies, I think in the rubric of patient engagement and digital engagement is really what we're talking about. And certainly any area of technology that further engages rather than alienates is going to help us not have that privileged advancement of solutions that are only for the wealthy, et cetera, et cetera. So translative services, and there are a number of vendors here and even EMR vendors who are already putting in place AI technologies that are interpreting multiple hundreds of languages. We have health centers that translate their meetings in hundreds of languages.
Wild.
Asian Health Services has a town hall, and they have over 100 languages that are being served at their health centers, and they provide that town hall in multiple languages to create inclusiveness.
Yeah.
So technologies that assist what they're already doing. Like we have a belief that access means language, affordability, quality, and any technology that helps advance that is, I think, right in line with our overall mission. So in the area of patient engagement, how do we get patients more engaged in the care that is easy, accessible to them, and culturally flexible, if you will, whether language or beliefs, et cetera, is really in line with what we're after, and that is health equity and access for the communities that we serve. And if there's a market for that, which I think within health centers there is, because there's a need for that, I think vendors that are here probably build solutions that they see as viable solutions that have a market for.
Yeah. How do you separate out problems that can be solved by technology versus problems that are fundamentally policy or structural? Because sometimes I think of, the criticism of Bill Gates, I've heard all his genius. He tried to solve every problem with newer technology. And so many things are policy related and technology can't solve them necessarily.
Yeah, that's an interesting question because I hadn't really thought of it like that. Yeah. But I would imagine whether you're in the nonprofit or for-profit, it's still a margin that drives your work, right? So there's still a business side to it. And I think the way I would look at that is, what are the policies that are getting in our way to finance the innovations, in our case at community health centers? So for example, I don't think AI is going to solve the fact that right now there is a financial barrier of having same-day visits for mental health and primary care. That's not a tech solution. That's just, hey, if you're wanting to integrate services, why are we putting these policies and financial reimbursement policies in place that get in the way of integration? So just as an example of AI is not going to solve that. That takes humans to discuss, is this really in our best interest if we're trying to integrate key services like behavioral health and primary care? But yet we have this policy that says, hey, you go into a health center, you're not going to get paid for those 2 visits in the same day.
Any other takeaways that you have about this conference, about tech and equity that will be worth sharing?
I probably am like you, where I come home and I call my hotel room home. That's how long it's been. But just trying to find that space of not negatively reeling or having my emotions take over of, oh, this is bad. But how do I see those opportunities where you do have like-minded companies who do have an interest in improving health? And that's sort of the Venn diagram for me. Is like, if we can have that common space and that idea and share the differences here that our community members are facing versus maybe your typical market that you've marketed to, and have them have an appreciation for that and have their creative mind say, I think we could solve some of that. And I think that's a win-win.
I'm so glad you're here. Makes me hopeful. And I think just representing voices that aren't able to come to spaces like this, right?
You.
I don't want to put that burden on you. Obviously, you can't represent how many million patients.
We have that burden on ourselves. It's okay. That's what we do. And there's so many passionate people. And it was a pleasure meeting you, Raj.
Yeah, you as well.
Thank you.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized by topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.